I have burning sensation and ulcerations in my mouth, which are troubling me from a very long time. There are also whitish patches, reddish patches inside my mouth. If this is your problem, you could be suffering from something called oral lichen planus. Oral lichen planus is a very common disease, but it is usually not diagnosed. It is an autoimmune disorder in which our own body starts making antibodies against our own cells. These antibodies, they attack the skin in the mouth and other body parts also, and they cause oral lichen planus. What problems can oral lichen planus cause? It can cause repeated ulcers in the mouth, repeated burning sensation, which is usually increased with any spicy food intake. It can also produce whitish lines or reddish patches inside the mouth. The most common areas which are involved in the mouth are the inside of the cheeks and the tongue. How is it diagnosed? The diagnosis of oral lichen planus is primarily clinical. Just by taking a look at the inside of the mouth, your doctor can tell whether it is oral lichen planus or it's some other lesion. So how it appears? It appears as reddish background with overlying white or purple lines. Sometimes these form a pattern. These are called Vikram's stria. These are most commonly seen on the inside of cheeks and the tongue. There are some other diseases which can appear like lichen planus, but they are not. For example, lichenoid eruptions due to some medicines, frictional hyperkeratosis, or any pemphigoid lesions. So the diagnosis of oral lichen planus actually depends on a biopsy, but in most cases biopsy is not needed and it is a clinical diagnosis only. Are there any other tests which we can do in oral lichen planus? Yes, routine blood workup, autoimmune panel, hepatitis C and other viral markers. Oral lichen planus has been known to associated with hepatitis C, and then biopsy. So like I said, biopsy is usually not needed, but the definitive diagnosis of oral lichen planus is on biopsy only. What is the treatment of oral lichen planus? So oral lichen planus is a prolonged disorder. It has a waxing and waning course. Sometimes there will be periods when it automatically goes away, and sometimes it will be flared up. The symptoms will increase. It is very important for a regular checkup for this disorder, because otherwise it is a benign problem, but in 3 to 4% people this lichen planus can be a pre-malignant disorder also, and it can progress to something more sinister. We have to avoid any pungent foods, spicy foods. We have to avoid alcohol, tobacco, smoking, and during medicines, we initially first line therapy is oral medicines, oral pastes. So the two most commonly we use are steroids and calcineurin inhibitors. These two medicines are available in oral gel. In the second line therapy, we give oral steroids. That is, we might have to give in certain cases when the problem is significant. There is a lot of pain, lot of burning sensation, and there is difficulty in swallowing and even speaking. Then we may have to give oral steroids also, and they usually work very well and they are generally safe. Then last, we might have to inject medicines also. So there are certain medicines which are available in injectable forms. We can apply and inject inside the mouth. So if you feel you have repeated ulcerations, repeated burning sensation in the mouth, you might be suffering from oral lichen planus. Do not try to self-diagnose. Just go to your doctor. Just by taking a look at the lesions, he will be able to tell in most of the cases whether this is oral lichen planus or not.